Let's talk about berberine. So berberine is a plant-derived compound that's used widely for treatment of such things as high blood pressure, high blood sugar, to reduce cardiovascular risk, even to prevent cancers. Problem: berberine is essentially non-absorbed. That is, if you took 100 milligrams of berberine, you pass out about 100 milligrams in the toilet. So why would it have these kinds of beneficial effects? Well, people have speculated that it's a metabolite of berberine that may exert all its benefits. But here's the thing. Berberine also has broad antimicrobial effects. That is, it's very effective in killing multiple species of bacteria and fungi. So think about this. What if someone had dysbiosis in the colon, that is a disruption of microbial species in the colon, or SIBO, small intestinal bacterial overgrowth, that is, the overproliferation and ascendance of fecal microbes from the colon into the 24 feet of small intestinal bacterial overgrowth, right? SIBO. Well, these two conditions, but especially SIBO, has multiple consequences for your health. For instance, it can raise blood pressure, raises blood sugar because it causes insulin resistance. It can cause inflammatory conditions in both the gastrointestinal tract and elsewhere in the body. It increases your likelihood of autoimmune conditions. It increases the likelihood of metabolic disorders like obesity and fatty liver. It increases your risk for coronary disease, heart attacks, and atrial fibrillation. It increases risk for dementia and other forms of cognitive impairment. Rosacea, psoriasis, name your disease, and SIBO, via the process of endotoxemia, that is the death of microbes in the small intestine. Small intestine is very permeable. Bacterial breakdown products enter the bloodstream. That's called endotoxemia. That's the driver. That's how microbes in the bowel can drive other health conditions. So think about this. Berberine, not absorbed, broad antimicrobial effects. It's highly likely the reason why berberine works is not because a metabolite gets absorbed or somehow a teensy-weensy microscopic quantity gets in your bloodstream. It's likely that it works because it kills off undesirable microbes, both bacterial and fungal. And that's one thing I should mention too. Lots of people have fungal overgrowth also, whether in the colon or in the small intestine, small intestinal fungal overgrowth. Well, berberine has both antibacterial and antifungal effects. Now, here's the problem. I hear people say things like, oh, I take berberine for my blood pressure, or I take berberine to reduce my blood sugar. In other words, taking this compound, this plant-based compound, chronically for a long, long time. Now, what's the effect of a long-term consumption of an antimicrobial? What we don't know, no one knows. What if you took penicillin for years? Weird things happen, right? Including antibiotic resistance and other effects. So what's the long-term consequence of taking an antimicrobial in the form of berberine? Well, here's the problem. Berberine, like most antimicrobials, are not selective for bad species only. So while it kills unhealthy species like E. coli, Salmonella, Campylobacter, Pseudomonas, as well as fungal species like Candida albicans, it also kills off beneficial species. We see this, for instance, in those of us who are trying to restore beneficial microbes like Lactobacillus reuteri or Lactobacillus gasseri and many others. We lose those species. So berberine is indiscriminate. It kills bad species that we don't want. It also kills good species. Well, what's the long-term consequence of killing off beneficial species? Because you're taking berberine, say, for high blood pressure. Well, you're going to lose musculature. You're going to have lower levels of multiple hormones. You're going to drop your level of oxytocin. You may encourage overgrowth of other species that are resistant or not susceptible to berberine. In other words, you can have very serious long-term consequences. Berberine is useful in the short term. That is, you can use it to kill off, say, the species of SIBO, or to push back fungal species, especially if they've proliferated in your small intestine. But taken over a long period, it will kill off beneficial species, and you've opened yourself up to multiple health problems, including colon cancer, diverticular disease, and inflammatory bowel conditions. And so, bottom line here, use berberine, but recognize it that its primary function is an antimicrobial that is indiscriminate. So use it for what it's really good at, its antimicrobial purposes, but don't rely on it long term because you will kill off beneficial species and you can develop very serious health problems long term. Now, if these kinds of conversations are a benefit to you, consider joining my conversations here on my YouTube channel, in my Defiant Health podcast, in my multiple online sites such as williamdavismd.com, my blog, or my inner circle, innercircle.drdavisinfinitehealth.com, where we talk about these kinds of things, including two-way Zoom conversations, typically once per week. We talk about all these things, deeper insights into health so that you're not damaged by your exposure to the healthcare system, doctors, and misinformation.